Hello, namaste, all my dear students. As I have promised you all that I'm going to make a manual on our previous course which we have done called Yoga Therapy and Healer course, Foundation Yoga Therapy and Healer course. And I'm sure that you guys have assimilated so many beautiful things out of our learnings, like teachings, learnings, everything which I have taught you. And further, as I have thought that I should make a manual on videos, so that you will be able to grasp it better and learn it better. So right now, what I'm going to do is, what I'm going to show you is that those things which we have done previously, and this is really going to remind you everything. Not only remind you, but it will always work as a catalyst to you to explore yourself and be very focused. So I'm going to start with this. So first of all, I would always ask you, and I would like to ask you always to keep your eyes closed and be in Namaste Mudra while keeping your elbow very, very close to your rib cage. Slowly inhale and slowly exhale. You are exhaling, but you are releasing all your heaviness from your body. This is the first thing you have to do. Few inhale, few exhale. Let's say 5 inhale and 5 exhale in the beginning. And then after, very simple sound. Like this sound for 5 times, and then after, with your smiley face, with your kind and beautiful face, you keep on rubbing your palm only. Just your palm, not your fingers. Keep rubbing it. A little bit of strength applied. Throughout, try to keep your spine straight. If you have anyone to guide, to heal, to work as a therapist, always try to ask their wish, ask their comfort, how comfortable they are. If they are not comfortable sitting down here, then you can always use props and bolster like this one. It's a tool, but you can always ask them to sit on the chair, or if you have a tool like this, it's perfect. So you can ask people to keep their knees together, sit on the edge of the chair or the sofa, and be simple. Okay? And the thing which I am going to do, start doing, is that to keep my right heel here close to my pelvis and the left foot on the ground while keeping my knee like this, and I'm sure you are able to see my foot. So you are going to move your foot very slowly, very gently with the help of your toes. So my one heel here. And for all of you, please do start with your left side always. Okay? So first I am keeping my palm like this and moving my toes very slowly. I am trying to use all my metatarsal, these are called metatarsal, all my foot sole, which is this, using all my joint of my foot, starting with the warm up, very slow and gentle. So the moment you reach here and you are not able to go further, then you come back here. then slowly start moving. If you are a new one, or if you are treating anybody who is new, very new, you can always ask their comfort. Remember to be very, very convenient and comfortable to your people and to yourself. Remember, this is a foundation course. In foundation course, we need to practice so much, and we need not to apply anything by ourselves. Let's explore these things simple and learn something out of it, and then let's go through the intermediate and advanced, and then you are going to be fully healing teacher. Right now you are learning it, you are in a foundation stage, so keep making your foundation strong, and then after we are going to obviously learn so many beautiful things, and I am sure about you all that you have learned well and you are going to learn well. So this is how you are moving your foot, and the moment you are move your foot like this, it's perfect. If somebody who is not sit like this and move their foot like this, then you can ask them to sit on the tool like this and move. Start this way, then slowly you can go down, sit on the cushion and ask them to move their foot like this, as you have understood everything before in the class, before in the course. So please, you have to move this way. The moment you are done with this movement, let's say at least 2.5 minutes from one leg, 2.5 minutes from the other leg. If you can do 5 minutes also, it's not going to harm you, it's going to benefit you. Then after, you can ask your people to sit down, or you sit down, and then slowly hold your both the knees like this, and then slowly inhale and exhale, inhale and exhale this way, if it is comfortable for you. If it is not comfortable, then again you can sit up here and hold your one knee here. Inhale, your toes goes up. Exhale, you go down. Inhale, you go up. Exhale, you go down. Inhale and exhale. So remember these tool movements. This is the simple tool which you can sit over, or if you have a chair, you can simply ask them to sit on the chair and do these movements. And then after, simply sit down and with the same movement, inhale, go up, and exhale, go down. Remember, slowly you can start squeezing your abdomen. So I am breathing in loud and exhaling loud just because I want you to understand the breathing technique. So the moment you understand these techniques, you are going to apply these techniques with yourself and to others. Very minutely, easy, very easy. Inhale and exhale. Every time remember, when you are inhaling, you are relaxed. When you exhale, you are very relaxed. Okay? So these two movements we are done with. This one and this one and this one and this one. And then after, simply start with the left. Then you grab, you hug your hamstring, you inhale, toes down, exhale, your toes pointing towards your side. Look, like this. Inhale, your toes down, exhale, your toes pointing towards yourself. Inhale, you go down, exhale, your toes goes up. I would like to tell you the benefits before I go beyond this one. You start from the toes movement, ankle movement, knee movement, these all things, they are actually working on any person who is having arthritis, osteoporosis, anything related to the joints, anything related to the veins, the nervous system. These all things, they are helping, sending the energy throughout your legs, and actually the movement of your foot is actually balancing your mind. From here, it is working here. It is sending the message that, hey, get ready, we are coming. So, this part is becoming very ready. So please be aware of all your joint movements and be very focused. So this way, inhale, and this way, exhale. This way, inhale, and this way, exhale. And at the end, you can stay like this, or with your comfort, with your people to whom you are guiding, with their comfort as well, you have to ask them to hold it this way. It's perfect. And keep straightening your knees and try to look at your toes. So this way you can read them. And then after, the same thing with this. So when you do this, it is actually working on your hamstring, working on your lower back even. It is relaxing your glutes, it is relaxing your lower back, it is mobilizing your whole lower legs and thighs. And then after completing, let's say for 2 minutes, 2 minutes this, 2 minutes this movement, and then after, start with the left, place your foot here and hug yourself this way. This is called Shishupalasana. This is great for your hip joints. So you can just inhale and exhale easy. You can keep your eyes open or closed. Keep moving like this. When you keep moving like this, you will find you are actually mobilizing your hip joints and your hips. After this, obviously you are going to do the right side. Remember, after each and every movement, you are trying your best to be in pause movement in Sukhasana, while keeping your left heel close to your pelvis and right heel just outside of your left ankle. Just remember one thing, that you are keeping your both the palm together at your heart center with a smiley face, with a beautiful smiley face, with the elbow together here at your rib cage. You close your eyes and do inhale and exhale for 10 breaths. Please do remember this one. This is very, very important. So, this one when you've done, let's say 2 minutes, start from the left, 2 minutes here. The same thing, if somebody who is not able to do it on the ground, you can ask them to sit over this kind of tool and then do the same thing. If not this way, then they can hold their ankle here and hold their knee here. And this way they can do it very well. Okay? The foundation course of therapy, yoga therapy and healing is to understand very well. And through your own practice, you are going to explore. You're going to find so many beautiful things in yourself. And the moment you start finding these things, I'm telling you, you are going to uplift yourself with your next course. With your next course, you will learn things like this and you will start to be more and more aware. So, the same thing is doing this one, the same thing is doing this one for those people who are not flexible enough. So after this one, what we are going to do is we are simply going to come into butterfly pose. If it is easy for you, this is again going to open up your pelvic joint. This is going to open up your inner thighs, and your inner thighs, your pelvis, everything, they matter the most. They are all the part of your joints. So after Sishupalasana, after baby sitting pose, you again come into 10 breaths of inhale and exhale while keeping your back straight. And then after this, you are doing this one. Very simple. Butterfly, inhaling and exhaling. Simple. If you can, include squeezing your glutes while exhaling, squeezing your abdomen while exhaling. It is going to bring so much of effect. So try to bring this awareness into yourself. Bring the awareness of exhale, squeezing your glutes and pelvis and abdomen. But it is not mandatory. I still tell you, it is not mandatory to do such things in the first class only or in the second class only. You can start doing after 15 days. Keep enhancing your abilities, keep enhancing your awareness. Slowly, when you do it 4, 5, 6 practices, 7 practices by yourself, you will start to be more and more aware and more focused. The moment you are more focused, you can include these breathing techniques into it, squeezing your glutes, squeezing your pelvis, squeezing your abdomen into it, and your face would be as it is, very relaxed and calm. So please move this way, and then after, stay like this, and slowly, very gently, you come back to the same, and then come into Namaste Mudra, 10 breaths easy. Remember, those people who are not able to do this way, it's okay for them. This is not required. Because it is very difficult to do this thing on this stool. So you should simply say no to this for them. They can simply do this for a few days, and then after they will start finding the flexibility, mobility, and then they can start doing the same thing while sitting on the ground. So this one is not prescribed to do this. Do it on this. So now after that, 10 breaths easy, 10 breaths. Exhale and inhale with your eyes closed, with a very calm, relaxed face and mind. Then after, you are going to come into your shoulder movement, if you have remember. And before that shoulder movement, I would like to remind you this one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Like you start always this way, this way, this way, this way. And remember those people who are having frozen shoulder, you can always ask them to move this way, slowly, very slowly, very slowly. Then slowly, slowly, slowly you straighten, straighten, straighten. Here, there is nothing like specific breathing in the beginning. Obviously, somebody who can reach here, they can start. So, in this position also, you can simply do breathing. So these movements will come later, but in the beginning you can always do this. You can go on this side, because for those people who are having frozen shoulder, for them it is very difficult to go up. So you have to be always very careful that you should not go up directly. Let them mobilize themselves this way, 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 this way. Always start with this. Start with this, this, slowly. And then after, try to go up like this, slow, slow, slow. If you find them comfortable, then slowly ask them to be here. And then after, Namaste Mudra, again the same formula, 10 inhale, 10 exhale. Okay? Then after, what you can do simply is, you can ask them to be here like this. Inhale, go up. So stay here, keep your biceps close to your ear. Keep your both the arms very close and straight. Keep opening your rib cage, keep opening your chest. This is very important. This is working on your lower back. This is working on your middle back. At the same time, it is working on your heart and lungs and your upper back and your cervical region too. This is very important to keep your back straight and keep your arms very straight and close to your ear. Obviously, when you are treating somebody who is new, they might not be able to move the same thing this way. So always go easy. If they are not able to do this one, it's perfect, no problem. You can always ask them to interlock their fingers, keep it behind. Inhale and exhale. Inhale and exhale. Inhale and exhale. Remember, and please look at this. Inhale and exhale. Inhale and exhale. So always try. I am sure that you understand my points, that we have to always heal people with ease. We don't have to apply anything which is tough and harsh. Simply after completing those things, those asanas and movements, if we just come into normal cross-leg sitting position and do Skanda Chakra, inhale and exhale, this is the further ones. Inhale, you go up, exhale, you come down, inhale, you go up, exhale, you come down. According to the beginners, according to those people who are not able to perform this very well and they are in the beginning of it, they can just, let's say, do it 5 times or maybe 10 times. So you can just go slow and try to open your rib cage, open your eyes, keep your eyes closed also, no problem, but you need to be very much focused and aware inside. Inhale, you go up, exhale, you come down. After this one, I would like to tell you, this is the greatest movement for those people who are having any cervical region problems. If somebody who has spondylitis, it works miraculous for them. After this one, you can do inhale and exhale with your eyes open, backward bending of your neck. Inhale, come at the center, exhale, go on your side. Inhale, come at the center, exhale, go on your side. Inhale and exhale. Especially like to tell you about why to do only backward bending. Like most of the people, they are having some trouble, in their neck. So let's not create more problems in their life, in their neck. Let's reduce the pain, because we are healers. So we should always try to be very much careful. And this is your foundation. So I would not tell you anything which is going to create any problem for anybody else in this world. So This is perfect. And then after, as I have taught you this also, to hold your knee, your left side knee, and stay like this if you are not able to raise your arms up. So if you are like this for a while and then change it to this position, just go like this, and then slowly come back. Inhale, raise your arms up, exhale, go a little on your right side. Inhale, come back, and exhale, go on your. This is just a great workout for your kidneys, for your liver, for your pancreas. It's just amazing. So and great for some people who have any back issues, especially in the middle back issues. Middle back, a little upper back. Obviously, your cervical region is getting healed through this one. So you can simply hold this and stay like this just for a while. Inhale and exhale, try to squeeze your glutes, pelvis and abdomen. Inhale, exhale, inhale, exhale. No need to go down, just stay like this straight. And obviously when you start finding flexibility, then you can slowly pull your rib cage. So this one is really going to help anyone who is having any problem in their middle of the back, any issues regarding kidneys or something. This is really going to activate and enhance the capacity of it. And then after, you can simply get into this position so that you start creating a space for your lungs and heart and your each and every organs. This is so good workout to reduce any sort of stress and headache, any sort of alignment problem people have. This is going to remove all the troubles and bring happiness in life. So inhale and exhale for the beginners, 10 breaths. For the people who have been doing it, they can do it at least for 3 minutes, 4 minutes, 5 minutes, no problem. Slowly come down every time after every movement or asanas. Come into Namaste Mudra, stay like this, and this is going to heal most of your troubles. And then after, special ones which we have done earlier as well, to reduce the stress from the tailbone region, stress from the hip region, stress from the almost top of the hamstring region. So this is going to help you. This is the beginners. This is for beginners who can just do that like this also. It's perfect. Those people who can pull it more behind, it's also perfect. Little bit more, also perfect. This is for beginners. And then slowly movement, more movement, pull it towards your side, hold it towards your side. This is just perfect. The same way, your left leg also going toward this side, hold it this way, keep your back straight, keep your face so relaxed, and then slowly you can do it like this as well. So this is something which is I want to show you these things because I want you to do it properly with your back straight. And I'm sure you are getting it so clearly. If there is any trouble, any confusion, you can ask me that how, and how can we just do it little more clearly and things like that. Obviously I'm telling you all the things a little quick, because these cameras, they create so much of gigabytes and it's very difficult to make it again and create it. So obviously I will create a small video if you guys have any confusion, any troubles. So after this one, it's very simple to be in Namaste Mudra again, and remember the healing, the sound healing. All sound is for your bottom chakra, Muladhara, Swadhisthana, and your Manipuraka. Muladhara is the base, Swadhisthana is the recreation, and your Manipuraka is your strength. So for this, so long sound, and for your emotion, your Anahata chakra, for your mind, hum. So these all three sound, it is the basic, the foundation of it. Through this we can create many sound, but I will teach you that further in our intermediate course. But until now, this is just enough, and I'm sure you are able to get it properly. If there is any trouble, please feel free to ask me that what happens when you are talking about this video at this second, okay? Like at the minutes, at the second, you will just try to point out and ask me. I'll describe you better and clearly. No worries about that. But please practice more. More and more practice is going to bring more and more wisdom in your life. Thank you so much, guys. I'm sure you are doing well, and please practice. Thank you so much. Namaste, and I will come up with something nice and more beautiful later on with your need. Thank you.